हेलो एवरीवन एंड वेलकम बैक टू द चैनल। आज हम लोग दोबारा वापस आ गए हैं 7th सेट ऑफ एमसीक्यू क्वेश्चंस के साथ। एंड आज जो वीडियो है उसमें हम लोग सिर्फ रिफ्लेक्सेस के क्वेश्चंस डिस्कस करेंगे। 30 क्वेश्चंस डिस्कस करेंगे इस वीडियो में। साथ साथ आंसर्स भी होंगे। आप चाहें तो पेन पेपर लेकर बैठ सकते हैं, ना भी बैठें तो चलेगा, आंसर्स साथ साथ में ही डिस्कस करेंगे। आज के सारे क्वेश्चंस रिफ्लेक्सेस के बारे में ही होने वाले हैं, ठीक है। इससे ये फ़ायदा है कि हम लोग का एक एक टॉपिक क्लियर होता जाएगा रादर दैन रैंडम प्रिपरेशन। तो स्टार्ट करते हैं। द फर्स्ट क्वेश्चन इज द बेबिंस्की रिफ्लेक्स इज कंसिडर्ड एबनॉर्मल इन infant, adults, both infants and adults, none of the above. The answer is adults. अगर आप लोगों को थोड़ा सा स्लो लगे तो आप प्लेबैक स्पीड को 0.5 या 1.5 पे भी फिक्स कर सकते हैं, बट मैं स्लो ही रखती हूँ सो दैट जो भी साथ साथ आंसर कर रहा है वो इजीली आंसर कर पाए। विच ऑफ द फॉलोइंग इज अ डीप टेंडन रिफ्लेक्स? बेबिंस्की रिफ्लेक्स, बाइसेप रिफ्लेक्स, रूटिंग रिफ्लेक्स और ग्रास्प रिफ्लेक्स? The answer to this question is bicep reflex. The knee jerk reflex is mediated by which nerve root? L23, L34, L5S1, S12. The right answer is L34. The jaw jerk reflex is mediated by which cranial nerve? Cranial number 5, 7, 9 or 10? The right answer is cranial number 5. The Hoffman's reflex is a test for lower motor neuron lesion, cerebellar dysfunction, upper motor neuron lesion or peripheral neuropathy. The answer to this question is upper motor neuron lesion. The Achilles tendon reflex assesses which spinal level? L23, 34, 45, S12. The right answer to this question is S12. The plantar reflex is also known as Babinski reflex, Moro reflex, Clonus reflex or rooting reflex. The right answer to this question is Babinski reflex. The abdominal reflex is absent in upper motor neuron lesion, lower motor neuron lesion, normal individuals or cerebellar lesions. The answer to this question is upper motor neuron lesions. The cremasteric reflex is mediated by L12, 34, S12, T12, L1. The right answer to this question is L12. The blink reflex is mediated by cranial nerve 2 and 7, cranial number 5 and 7, cranial number 3, cranial nerve 3 and 7, cranial nerve 9th and 10th. The right answer to this question is cranial nerve 5 and 7. The pupillary light reflex involves which cranial nerves? कौन सी cranial nerves में pupillary light reflex involve होता है? Cranial number 2 and 3, cranial nerve 3 and 5, cranial nerve 4 and 6, cranial nerve 2 and 7. Pupillary light reflex. The right answer is cranial nerve 2 and 3. Which reflex is tested by stroking the sole of the foot? Moro reflex, Babinski reflex, Hoffman reflex, patellar reflex. The right answer is Babinski reflex. The glabellar reflex is seen in Parkinson disease, cerebral palsy, spinal cord injuries, multiple sclerosis. The right answer is Parkinson's disease. The Moro reflex is normally seen in adults, infants, elderly patients, patients with spinal injuries. The right answer is infants. The suck reflex is present in neonates, adults, only premature babies, only term babies. The right answer is neonates. The gag reflex is controlled by which cranial nerve? Seventh cranial nerve, ninth cranial nerve, or cranial nerve 9 and 10, cranial nerve 5 and 7, cranial nerve 11 and 12. The right answer is cranial nerve 9 and 10. Clonus is associated with LMN lesion, UMN lesion, peripheral neuropathy, or myopathy. The right answer is UMN lesions. Hyporeflexia is commonly seen in UMN lesion, LMN lesion, cerebellar disorders, basal ganglia disorders. The right answer is LMN lesions. The oculocephalic reflex, which is also known as the doll eye reflex, is used to assess brainstem function, cerebellar function, vestibular function, or basal ganglia function. The right answer is brainstem function. The rooting reflex is present until what age? Rooting reflex किस एज तक होता है? 1 month, 3 months, 6 months or 12 months? The right answer is 3 months. The asymmetrical tonic neck reflex 8ENR disappears by 2 months, 4 months, 6 months or 12 months. The right answer is 6 months. The Landau reflex is observed in which age group? Newborns, 3 months to 12 months, 1 year and older, or adults? The right answer is 3 months to 12 months. The tonic labyrinthine reflex TLR is involved in vestibular function, gait pattern, upper limb function, or lower limb function. The right answer is vestibular function. The Hoffman reflex is tested by flicking which finger? Index finger, middle finger, ring finger, or thumb? The right answer is middle finger. The palmomental reflex is seen in stroke patients, normal patients, normal infants, Parkinson's patient, or all of the above. पाल्मोमेंटल रिफ्लेक्स किस में हमें देखने को मिलता है? स्ट्रोक पेशेंट्स में, इन्फेंट्स में, नॉर्मल इन्फेंट्स में, या फिर पार्किंसंस के पेशेंट्स में, या फिर इन सब में? द राइट आंसर इज ऑल ऑफ द अबव. The Gordon's reflex is a variant of Babinski reflex, Moro reflex, Hoffman reflex, or rooting reflex. The right answer is Babinski reflex. Absent cremasteric reflex is seen in spinal cord injury, testicular torsion, UMN lesion, or all of the above. The right answer is all of the above. The parachute reflex helps in feeding, protection from falls, balance control or swallowing. नाम से समझ में आ रहा है? The right answer is protection from falls. Pendular reflexes are commonly seen in hyperthyroidism, hypothyroidism, cerebellar disorders, or stroke. The right answer is cerebellar disorders. The Westphal sign is seen in hyperreflexia, absent knee-jerk reflex, hypertonia, or exaggerated reflexes. The right answer is absent knee-jerk reflexes. That's it for today. I hope आप लोगों को कुछ नया सीखने को मिला होगा. एंड और ऐसे टॉपिक्स देखने के लिए आप सब्सक्राइब कर सकते हैं या कमेंट कर सकते हैं कि हम नेक्स्ट टॉपिक कौन सा डिस्कस करें. थैंक यू फॉर वॉचिंग.